So, the biggest move in healthcare right now is the shift from hospitals and clinics to home. With the advent of better technology, more and more things are possible. Now, this is true for medication management, in-field nursing, remote patient monitoring, and even having virtual visits with the doctors themselves. But did you know that dialysis can be done at home without the aid of a nurse or a tech? Yep. On today's episode, the top 5 reasons why you should do dialysis at home. What's up, San Antonio and world? I'm Dr. Qasim Butt, and I'm a kidney doctor, and I'm here to break down health in a simple way. Now, do me a favor, hit up that like, share, and subscribe button. It'll really help me out. One of the most recent pushes by both Medicare and private insurance companies is to get more of their patients to do dialysis at home. The thing you need to know about dialysis at home, it has its inherent benefits over doing dialysis in a center away from home. Better quality of life and autonomy. The main reason I believe patients to do dialysis at home is something I'm a really big fan of: patient empowerment. All of a sudden, you take a process that's normally done by a tech or a nurse, and you put the patient in the driver's seat. All of a sudden, they themselves are in charge of their own health and can take care of things like timing of the dialysis itself. So that gives them more autonomy to do things like go to work, hang out with family, or even go on vacation. Full-time nursing assistants. Now, when you're doing dialysis at home, I want you to understand you're not alone. You're not actually alone. You have full-time 24/7 nursing assistants available to you via text or telephone. Okay? Now, if anything more complicated arises, you can always go to a physical dialysis unit to get checked out by the nurses themselves. Less hospitalizations and better mortality. Now, with home dialysis treatments, you're typically getting the treatments more frequently, meaning more times a week than you do in an in-center. Because of that, your blood is getting clean more often, giving less time for more fluid and toxins to accumulate in your blood. What this does is it creates a situation of lesser stress on both your body and your heart. And typically, patients on home dialysis have less visits to the hospital and actually live longer than those that actually do dialysis in center. Less restrictions on diet. Now, patients on dialysis typically have to limit the amount of fluid they can take in a day, and oftentimes have to be on really strict diets, avoiding foods that are high in potassium and high in phosphorus, which quite honestly can be a huge drain on the enjoyment of the food you can eat. Now, taking to the point I just made about more frequent dialysis and your blood getting clean more often, because of this, you can oftentimes let up on those restrictions a bit and enjoy more of a normal diet. Better personalized care. Now, this is something that I actually enjoy. With home dialysis, you get to have a monthly meeting with your entire care team, your doctor, your nurse, your dietitian, your case manager, in the privacy of a separate room. These meetings are oftentimes more personal, and what's cool is you can actually have family members or caregivers attend these meetings to give you a more customized care plan. If you found this video helpful, please like and share it. Oh, you got something to say? Please leave comments in the comment section below. And remember, it's your kidneys, your health.